let me ask, what should we be aspiring to do in healthcare? And I will take it back to basics. I wrote something recently, and I said, an ideal healthcare system will provide better health to more people at lower cost on a continuous basis. It's kind of a mouthful, so let me take it piece by piece because every piece is important. An ideal healthcare system. Ideal, this is something to aspire to. Probably not something you ever achieve, but something you aspire to. Will provide better health. I didn't say health insurance. I didn't say health care. There's a distinction. The purpose of this ought to be to make people healthier, not to put an insurance card in their pocket or to get them in front of a doctor doing something to them that doesn't necessarily improve their health. To more people, expand it. Coverage does matter. At lower cost. You know, we've been seeing prices soaring for decades and decades and decades. You don't get the sort of disruptive innovation that you see in computers. And on a continuous basis, which means we don't just get lower costs and better quality now and then when the government passes a law and says, we're going to do this now and it's done. It's got to be a process, something that happens day in, day out. So what happens when Steve Jobs and Bill Gates come into the computer market? 1965, every computer on Earth would have been the size of a room. Maybe not quite this big a room, but room size. And would have cost in the millions of dollars. By today's reckoning, probably tens of millions of dollars in today's dollars. And again, they weren't terribly powerful. I like to point out to my students that the Voyager spacecraft, which has now left the solar system, took magnificent pictures of the outer planets. The internal RAM of that computer was 64K. That's how far computers have come. Well, what we had at that point was we were, up till 1965, we were getting bigger computers for fewer people at higher cost and change only episodically. What happened with the disruptive innovation that starts really it starts in 1965 when a company called DEC, which you may never heard of for a good reason, DEC offered the first mini computer for $19,000. That was disruptive innovation. It didn't do as much as the mainframe, but you could get it for $19,000 instead of a couple million. And it changed the world. And lo and behold, within 10 years, DEC's gone because people like Steve Jobs and Bill Gates came in and said, you know, you don't really need to spend $19,000. We can make one about this big for a couple thousand. And the world begins to change. And then cell phones and up to today's smartphones. And we got better computers for more people at lower cost on a continuous basis. Exactly what I think we need in healthcare, and we prevent that from happening. So if you took today's centralizers, decentralizers, and I'll say consumers of healthcare, and take their arguments and transplant the rhetoric on the computer market in 1965, the centralizers would have been saying, okay, computers are too expensive. Cheapest computer out there is $1 million. It's all because IBM is a for-profit enterprise, so what we need is the government to make computers, and the government will do it for $975,000, and that'll be great. And if they don't make them, at least they can buy all of them and distribute them. They can be a single-payer computer system, or regulate them or whatever. The decentralizers, using today's healthcare rhetoric, would have been saying, no, actually what we need is more reliance on the market. We need competition. So what we're going to do is we're going to open a mainframe computer store at every shopping mall. So you can go over here. You can go in Maryland or Virginia and buy your mainframe. And that'll get that price down from $1 million to $975,000. The businesses that buy computers would have been saying, no, what we're going to do is we're going to use our market power, the strength of us together, and we're going to tell IBM, we're not paying a cent more than $975,000, and that's it. Meanwhile, the centralizers, the decentralizers, and the business customers would have all gotten together and said, let's make real sure that no one can work in his garage and make a little computer about this big that costs $1,000 or $2,000. Let's make it illegal. Let's establish regulations that assure that that is never going to happen. That's essentially what we've done in healthcare. And it's not the fault of either party, either ideology, or centralizers, decentralized. They've all agreed to do these things. Now exactly how is a topic for a longer discussion, and that's exactly what we're working on at Mercatus to explain.